If you look up regenerative medicine on the internet, you will most likely see articles on stem cell and stem cell treatments. The stem cell treatment is not all there is to regenerative medicine. It's certainly an important part. Some important questions that might come to mind are, if the body was designed to heal, then why do we need stem cell treatments? And if the body contains its own stem cells, why do we need to implement stem cells to do the healing work? We're going to look at the different stem cell and stem cell derived products and learn of their efficacy and risks. We're also going to look at the history of stem cell treatment and how it's regulated here in the United States. So, stay tuned and find out. I am Dr. Victoria Munoz, and I specialize in regenerative medicine. Regenerative medicine is a specialty area of medicine that serves to heal and repair the body and reverse aging by providing the tools to stimulate the body's intrinsic ability to heal. My goal as a doctor is to educate, heal, and reach the masses with the message of regenerative medicine. So I'd like to start with looking at a historic timeline of stem cell here in the United States. The term stem cell has gotten a bad rap. This is not due to the fact that stem cell treatments don't work, but more due to the political history of use of stem cell in the United States. Stem cell has been used in medicine since the 1950s. It started as a treatment for leukemia in the form of bone marrow transplants. Congress got involved in 1974, but federal funds were banned in 1996 through the Dickey-Wicker Amendment to protect the destruction of human embryos. Now, I want to just say right here that the stem cell products that are used today for regenerative treatment do not come from embryos. They come from planned C-section placenta. It wasn't until the year 2000 that the term stem cell resurfaced when the National Institute for Health, or the NIH, implemented guidelines for research on embryonic stem cell, indicating that human embryonic stem cell could be used under certain criteria regarding private funding and donor consent. Between 2005 and 2007, Congress passed two bills through the Stem Cell Research Enhancement Act, which were both vetoed by President George Bush. However, in 2009, President Barack Obama reversed the 2001 executive order allowing possible scientific research involving human stem cell. In 2012, we saw the first transplant of human adult stem cells in heart attack patients. This was the first documented case showing the effectiveness of the regenerative power of stem cells. The outcome of treatment showed decreased scarring and the regrowth of heart tissue. This was revolutionary. 2013 presented new innovations in stem cell and stem cell research. Oregon Health and Science University researchers, which is my alma mater, successfully reprogrammed human stem cells into embryonic stem cells, replacing the DNA in egg cells with that of human skin cells. This technique was called somatic cell nuclear transplant. December 13th, 2016, President Barack Obama signed the 21st Century Cures Act, which supported the FDA's decision-making process in the development of drugs, biologics, and medical devices for the purpose of bringing these technologies to patients faster and more efficiently. Now let's have a look at FDA regulation. The FDA tightly regulates the biologics industry. May 25, 2005, the current good tissue practice guidelines were developed for manufacturers by the FDA. This was to ensure that human cells and cellular tissue-based products are safe and effective for clinical application. The FDA has released documentation defining human cell tissue-based products. With the implementation of these guidelines, the FDA has tightened its regulation, and all manufacturers of biologics are required to be in compliance as of 11/2020. So what are stem cells? Stem cells are ubiquitous in the body and appear in many different organs, including the brain, blood, bone marrow, muscle, skin, heart, and liver. Stem cells essentially remain dormant until required for the purpose of regenerating damaged tissue. The stem cells that are present in the adult human are called somatic stem cells. These cells have already differentiated and are organ and tissue specific. For example, adult stem cells of the skin are responsible for regenerating tissue of the skin only. The other kind of stem cells are called mesenchymal and are pluripotent in nature, meaning that these cells are undifferentiated and non-specific to any cell type. So we see tissue generation in nature. Various species, some closely related to humans, have the ability to regenerate complete body parts. The planarian flatworm and acorn worm will regrow into several new worms if severed. The axolotl salamander can regenerate its brain and spinal cord when severed. Since humans have a close relationship genetically to the salamander, the question lies as to whether humans could be reprogrammed to regrow entire limbs or organs. When the mammal is wounded, a clot develops over the wound in an attempt to stop bleeding. Because the human's immune system is highly specialized, the formation of clots and scar tissue is an effort to prevent infections and cancers. So humans do retain the same genetic regenerative potential as these lower species, but these mechanisms slowly turn off as development progresses. So now let's have a look at the different stem cell and stem cell derived products. The term stem cell and stem cell derived will become more clear as we go through this list. So the first product is lyophilized. Now, lyophilization is the process of freeze drying. Water is removed from the product after freezing and then placed in a vacuum. This allows the ice to change from a solid to vapor without going through the liquid phase. This technique is meant to enhance the stability of the dry powder, which is the form in which stem cells are derived with this technique. Risks with this delivery system are as follows. Bioburden. Though the product is tested for bioburden prior to sterilization, this does not test for endotoxins, particularly gram-negative organisms. Because the stoppers are only partially sealed when placed in the lyophilizer, the vials are subject to contamination. Pre-freezing the lyophilizer, which is required, can cause ice formation on the shelves before the product is loaded, causing defect in the product. And there's always risk when a vacuum system is used of leakage into the system from an outer source. Once the product is complete, several tests must be performed to ensure safety and efficacy, including potency, stability, and sterility. The big problem with this product is poor solubility. The product must be reconstituted with sterile saline, posing the risk of loss of potency and pain on injection. Now we're going to move on to talk about allograft. Now, allograft is a stem cell derived product. What that means is that it comes from mesenchymal stem cells, but it is the cells inside the stem cell, the growth factors and the cytokines that do the regenerative work without the cell particles, including the cell wall. So this tissue is derived from donated planned C-section placenta and amniotic fluid, both of which contain mesenchymal stem cells. Now remember what I said about these cells. They're highly regenerative. These cells are grown in a medium, cell particles are washed out, and then we're left with just the proteins, such as the growth factors and cytokines, that do the regenerative work. These cells are immune privileged, meaning that there is no risk of rejection by the recipient's immune system. For example, if a patient receives a donor heart, the cells of that heart tissue contain antigens. What antigens do is they identify you as you and me as me, and are very immune system specific. Therefore, if I was a recipient, of a donor heart, for example, my immune system would not recognize those cells and begin to attack them as foreign. So, if a recipient of an organ like a heart, a liver, or anything else has a transplant, they must be on immune suppressing medications for a lifetime, otherwise their immune system will reject that tissue. On the other hand, these mesenchymal stem cells do not have antigens on the surface of their cells and therefore are immune privileged, meaning there is no risk of anybody's immune system rejecting them. So some risks of using this product might be contaminated product. This can be avoided by ensuring your product comes from an FDA compliant manufacturer. Infection at the injection site. This can be avoided by using sterile technique and using strict aftercare instructions. Patient doesn't get better. This can be avoided by doing a thorough assessment prior to the procedure. Lifestyle choices of the patient might prevent the cells from mounting a proper immune response due to systemic inflammation. So, for example, if I have a patient that comes in that has diabetes that is poorly managed, an autoimmune condition that is poorly managed, they smoke, they drink alcohol, they have a poor diet, they have inflammation throughout their body, chances are the stem cell treatment is not going to be as effective as if I managed the patient's health, got them into a good healthy state prior to treatment. Benefits of using this product: powerful in repairing injured soft tissue, very powerful. Reduced inflammation at the injury site. The reason for this is because the product contains natural anti-inflammatory markers which reduce the inflammation while inducing healing. Immediate pain relief due to anti-inflammatory markers in the product. Again, easy application without causing patient multiple procedures, and we'll kind of discuss that as we go. Some procedures require a surgical procedure before implementing stem cell. That is not the case with the allograft. Long-term benefit as tissue repairs and heals permanently. Quality of life as patient can resume activities that once limited them. The product can be stored at ambient temperatures, so no cryo tank is required, and no downtime for the patient following the procedure. And then there's cord blood. Cord blood is collected from vessels of placenta and umbilical cord following childbirth according to strict guidelines by the FDA. Approved use of cord blood is for hematopoietic stem cell transplant and are used for cancers of the blood and sickle cell anemia. Following the collection of these cells, they can be safely cryopreserved for many years. Cord blood does contain stem cells and is proving to have remarkable regenerative potential. There is no risk of adverse effect, such as host versus graft disease. Remember, we talked about the rejection of donated tissue. Some risks of using this product might be death of cells. This product must be cryopreserved, contamination of the product, and again, using a manufacturer that is FDA compliant is key. Infection at injection site, use of sterile technique can alleviate this. Use other than what it is intended for. Some clinics claim that cord blood can cure any disease. Well, research doesn't support this claim and only approves its use for blood-related illnesses. Benefits of using cord blood would be highly regenerative, very effective in supporting blood and immune cell production. Only one procedure is required. It's easier than harvesting the patient's own autologous stem cells from their bone marrow. And quality of life, getting the patient's health back, is the goal. Now, the next product I want to touch on is adipose, also known as autologous stem cell, meaning comes from self. These adult stem cells are collected from the fat cells of the body through a process called liposuction. These cells are mesenchymal progenitor cells and are multipotent in nature, meaning they have already lived out several life cycles and have limited regenerative potential. When mesenchymal stem cells come from adipose, they're called adipose-specific derived stem cells, or ACSs. Once collected, this tissue is called lipoaspirate. The cells then go through a series of centrifugation sessions to separate the ACSs from the rest of the tissue. The enzyme collagenase is then added to break down the matrix, revealing the mesenchymal stem cells, more specifically adipose-specific derived stem cells, or ACSs. With each centrifugation cycle, the collagen is washed out to prevent long-term contact with the ACSs. These cells are most effective in regenerating cartilage and bone. Some risks might include infection at the lipoaspirate surgery site. Using sterile technique, again, is key in preventing infection. Adverse reaction to the anesthetic. Assessing the patient for possible allergies prior to procedure is key. Difficulty in gauging accuracy of the MCSs or mesenchymal stem cell yield. This technique does require 2 procedures for a single treatment. Remember, we have to aspirate or remove the fat cells first, process it down, and then the patient comes back days later to have the product injected into their injury site. There's no established therapeutic range for cell concentration. There's lack of spontaneity because, again, it requires days before application. And it does have limited use. You cannot give it through an IV or a nebulizer. However, some benefits are reduced pain following treatment. It's autologous, so there's no risk of tissue rejection, and it facilitates bone and cartilage regeneration. And this next kind of stem cell product comes from bone marrow. Bone marrow is a spongy tissue inside of our bones. The cells of this tissue are hemopoietic, meaning that they produce red blood cells, white blood cells, and platelets. The marrow must first be aspirated, and this is a surgical procedure requiring the patient to be completely under. The aspirate is filtered to remove bone fragments and then centrifuged. The bone marrow aspirate contains MSCs, or mesenchymal stem cells. The bone marrow aspirate is typically used for joint pain related to osteoarthritis, degenerative disc, such as in the spine, and tendon tears. The aspirate is typically taken from the iliac crest of the hip, proximal humerus, or distal femur. The iliac crest proves to have the greatest yield of mesenchymal stem cells and is typically used first. Because the greater the concentration of the mesenchymal stem cells, the faster the patient is out of pain and heals. Some risks with using this product might be infection at aspirate surgery site. Of course, then again, using sterile technique can help alleviate this. It is difficult to gauge accuracy of the mesenchymal stem cell yield, questionable variability of cells. This does require 2 procedures. Once again, a surgical procedure to remove the cells from the bone marrow. It has to be processed, and then the patient comes back a couple days later for the application. And there is no established therapeutic range for cell concentration. Benefits for using this product would be it's autologous because it comes from the patient's own bone marrow, so there's no risk of tissue rejection. Effective in treating blood-related illnesses and bone pathologies. And quality of life, again, getting the patient's health back is the goal. So that pretty much sums up stem cell and stem cell derived products. You as a consumer have the right to ask your doctor a few questions. One of them being, are they certified to do regenerative injections? Just because a doctor went to medical school doesn't mean that they are certified to do these types of treatments. And there are doctors out there that are not certified that are doing these kinds of treatments. Another question you have the right to ask your doctor is, what is the product and where did it come from? That is very important. There are doctors who are charging maybe $6,000 for a procedure, and other doctors may be charging $1,000 or $2,000 for a procedure. It is very important to know why there's a price difference. The doctor that's charging $2,000 for their treatment, that is maybe normally a $6,000 treatment, for example, may be using an inferior product. So not all stem cell products are made equally, and I think it's very important to understand this. I myself, as a doctor, I use the allograft. The reason for this is because, number one, it's very versatile. I can inject into a joint or any soft tissue. I can give it IV, and I can also give it through a nebulizer. Number two, the product is just the growth factors and the cytokines that come from the mesenchymal stem cells. So essentially, it's all the proteins that do the regenerative work without the cell particles. The beauty of this is that it is shelf stable at ambient temperatures for about 1 year. It is easy to use. It does not require a cryo tank. With products that are required to be cryopreserved, there is a very, very small window as to when the product is removed from the cryo tank and then implemented as a treatment into the patient. So there is the risk of cell death from the moment it is taken out to actually injecting it into the patient's soft tissue injury. Now, whole cells are not required to regenerate soft tissue injury. What happens is when you inject whole life stem cells into an injury, the cells die almost immediately. And what happens is there's the release of the growth factors and the cytokines, the regenerative proteins inside the cell that do the regenerative work. So the beauty of the allograft is that this step is alleviated by not having live cells to begin with. Basically, it's just the regenerative proteins such as the growth factors and the cytokines that are used for the regenerative work. So hey guys, tune in for our next episode when we start talking about what is leaky gut. If you'd like more details or you would like to get a head start, you can purchase my book, The Pain Solution. You will find 2 links in the description below. One is to purchase the book on Amazon, and the other is to contact me directly through my website to get a signed copy that I will mail to you at no extra cost. As many of you know, each episode in this series, Our Regenerative Potential, is coming from points in my book, The Pain Solution. The Pain Solution is a comprehensive guide of healing the body and reversing aging. It is not a short read. It is 315 pages and is everything you need to know from A to Z about healing your body and reversing aging and being in control of your own health care. Please like this video and subscribe to my channel if you haven't already. Hit that notification bell to receive all notifications so that you don't miss out on any more great videos to come. Also, please leave a comment below on how this video has helped you. I am Dr. Victoria Munoz, CEO and owner of Regenerative Sports Medicine and Anti-Aging, where we've been rebuilding bodies since 2017. Until next time, take care.